COVID-19 vaccination efforts continue to ramp up across the country. And today we learned the University of Missouri has the capacity to give 4,000 shots a day at the football stadium.
And today, Senator Roy Blunt was at the site for a tour. Our Missouri Chief Capitol Bureau reporter Emily Manley was also there, and she joins us now live with more. Emily.
Well, Mandy and Vic, what would the state or the country do differently if we went back a year ago when the pandemic just started? Well, Senator Roy Blunt said today that he would not stop elective surgeries, but he does say that the pandemic has helped people trust vaccines.
So then you register, then you do the shots, and then you go.
As the pandemic moves into the rearview mirror, one of Missouri's senators is thinking about what could have been done differently.
Eliminating elective surgeries, I think, turned out to be an almost across-the-board loser.
Go back in time 9 months ago when we turned off elective procedures. 35% of our revenue evaporated overnight because we didn't stop having strokes or heart attacks or traumas just because this COVID pandemic was going on.
And the ability to talk to a doctor on the phone.
Telehealth generally, we probably should have done 5 years ago what we did last year.
During a roundtable discussion with Mizzou administrators and MU healthcare physicians, Senator Roy Blunt says now the focus becomes vaccine hesitancy.
Part of the job of the Federal Drug Administration is not to approve vaccines, emergency or otherwise, unless they're clearly understood and proven to be safe.
Missouri's governor has stated he does not support a vaccine passport, and Blunt agrees.
The White House press person this week said that we would not require vaccines in the United States of America, and the governor has that same view, and I agree with both of them.
Blunt says people should take it upon themselves to get vaccinated.
Friends at church or friends at wherever begin to have a vaccine and reconnect with their families and not have negative health consequences. I just think people are going to be reminded again of the social responsibility, if not the requirement.
And because of the pandemic, he thinks hesitancy for other vaccines has lessened.
We're going to see a rethinking maybe of how important vaccines can be.
Now, Blunt also told that roundtable today that another one of his main focus is mental health because of the stress that people were put under for separation and isolation. You also heard Vic say that MU is able to do 4,000 vaccines a day. But the problem is, at the moment, they just don't have that much vaccine to give.